according to state. So just a little bit about Molina. It is a Fortune 500 company. We're currently ranked 125th. And this organization provides managed healthcare services under the Medicaid and Medicare programs and state insurance marketplaces. This is an overview of our 2026 service area. So we do have quite a bit of changes happening. There's going to be expansion in 4 states. 7 of our states have no change in the footprint. So let's go state by state and see what that looks like. First is California, maintaining our existing footprint here. Here are the benefits for California. No major changes here for the most part. I did want to point out that services without a deductible are going to be those services that are highlighted in blue. So as you can see, especially on some of our silver plans there and the gold and platinum, the ER has a copay, which is a very rich benefit. Members are very happy with that. Next is some of the benefits in detail. I'm not going to go line by line. We've got too many states to cover here today. But again, just want to remind folks that all of the benefits highlighted in blue are without any deductible. This is just taking a look at the prescription coverage on those plans. Again, across the board on all of our plans, preventative drugs are at no charge. These are the 2026 regional rates. As you can see, we do have some competitive options for sure, especially if you look at Imperial County. We have the lowest cost silver, gold, and platinum plans. So if you do sell in California and you do have additional questions to go more in depth, we do offer state-specific trainings that you can also register at molinaagentcenter.com if you did want to go any more details into those specific states we're going over. Next is Connecticut. We're in the entire state. That's our current footprint. So Connecticut 2026 plan offerings. Okay, so access to Connecticut on exchange. So we have the Connecticut Benefits Inc. This is the choice. This is a larger Connecticut network. And then you have the value. That's going to be the more narrow Connecticut network. We also have some off exchange plans. So all of the choice and value plans offered on exchange are offered off exchange. Did want to note 3 of the solo plans provide access to New York providers. These are the 4 standard options that you're going to have, one of which is an HSA bronze compatible. The Connecticut will continue to offer 3 additional plans. So they have one alternative bronze option with dental and vision, one alternative gold option, and a choice catastrophic with dental and vision. So on and off exchange, the plans here, so you have the 4 standard options. Most notable plan difference here is the value plans do not include Yale New Haven Hospital System and all affiliated hospitals and providers within that state. So who is eligible for Connecticut? This will tell you the Connecticut residents age 19 to 64. This goes over the household income requirements. It also talks about some of the benefits and how they work for those members. For off exchange, the 2026 solo plans, there's 3 options here. And the most notable plan difference is going to be the network. Okay, so the solo plans use our largest commercial network, and they're going to offer access to some New York providers. Most notably is going to be the Hospital for Special Surgery, Montefiore, and Memorial Sloan Kettering. There will be some plans discontinued and mapped to another plan in 2026. And quoting for the solo plans will be via Health Sherpa for 2026. The standalone dental plans for Connecticut, they're sold on Access Health Connecticut exchange, and it's with or without medical. 2 plans to choose from. You get the standard or the basic. Right. Most notably, I think the biggest difference is your basic has half the annual limit amount, and you're going to have a little bit more out-of-pocket costs. As far as waiting periods, they are the same. Next is Florida. So Florida has 3 expansion counties. We have Collier in the southwest part of the state, and then growing in our central market is Lake and Marion counties. Idaho, our footprint will remain the same. These are some of the major provider groups in Idaho. So if you sell here, this is a great quick reference for helping out those members, letting them know who's in network. Illinois, again, no changes here, same footprint. Kentucky has quite a bit of change. So we are exiting 25 counties and we are expanding into 1. Next is Michigan. For 2026, we are exiting all counties. Mississippi, no change to the footprint. We're in the entire state.